Hi there, Dr. Matt Wunderlich here. So we're getting back to the topic of the week. We had a little break with Thanksgiving last week. I hope everybody had a wonderful Thanksgiving. I'm going to talk loud just because I'm losing my voice here, so I hope you can hear me well. But the topic of the week this week is shoulder pain. A lot of patients I see come in, and usually it's neck or back pain they have, but then they tell me later they have some shoulder pain as well. Most patients think there's nothing we can do about that, or that they're eventually going to have surgery on their shoulder. Believe me, you don't want to have surgery on your shoulder. It's not a very pleasant experience, and it's not a very good recovery. My dad personally had to have it done. He tore up his shoulder in an accident. Still hasn't fully recovered. Still having issues with it. So shoulder surgery, if you can avoid it, you really should try. So that said, there's a lot of different things going on in the shoulder. The shoulder is a wonderful joint. Very mobile, very flexible. You can move it in almost in any direction. And that's part of the problem with the shoulder. It's not a very stable joint. So basically your shoulder just kind of hangs there, and it's held there by all the muscles and ligaments and tendons in there. It holds your shoulder, and like I said, it gives you a lot of great motion. But when you hurt something or injure it, you can feel it, and it usually lingers for quite a while. It's hard not to use your shoulder, okay? So you can have tendinitis of the tendons, bursitis, so inflammation of the bursa sac. You can have tears in the muscles or ligaments. So there's all kinds of things that can be affecting it. So what we do is we do a thorough examination. We'll go through, check the rotator cuff muscles, see what's tight, and a lot of times what we find out is the muscles are real tight. Your shoulder gets kind of pulled up into the joint, and so it limits a lot of the motion you have. So what we need to do is really kind of stretch that back out, get that shoulder hanging back to where it should, and get the motion back in there. So we do a lot of manual work with shoulders. So I'm going to show you some stretches and some great exercises, band exercises, TheraBand exercises work great for the shoulder to rehab. It takes time, so be patient with the shoulder. If you have a shoulder injury, take your time, do the work, it will get better. And I'm going to show you some tips this week on how to fix that, okay? So if you have questions, just let me know, send me a message. Otherwise, stay tuned and I will go through some stuff this week you can do for your shoulder pain. All right? Thank you.